So today we will talk about the principles of treatment of venomous snake bite. So first of all, we have to tell the patient that every snake is not poisonous, and even if it is poisonous, it is not fully charged. And even if it is fully charged, it does not always inject a lethal dose. We have to do this to remove the anxiety and fright of the patient because it can be very dangerous for him. The second important thing is that we have to prevent the spread of the venom. Now, the spread of the venom occurs via diffusion and lymph circulation. So, we have to mainly reduce the lymph circulation. Now, for that, we can do immobilization of that part which has the snake bite. And if the snake bite is on a limb, then we can tie a tourniquet. It can be applied up to 2 hours. Now, how to apply it? It is applied 5 cm proximal to the bite site, and it should be tight enough to occlude the superficial veins and the lymphatic circulation. But remember, it should not occlude the deep arterial circulation, and the deep venous circulation should also be not occluded. Then we release this for 1 minute after every half an hour. Why do we release the tourniquet like this? To allow small amount of the poison to enter the general circulation where it can be destroyed. Then we can also cleanse the wound with water and saline. Now the third thing that we can do to prevent the spread of the poison is incision and suction. We give free incisions through the fang marks, and then we suck the poison via mouth or pump, but make sure that in your mouth there is no ulcer or injury on the tongue or lips. Otherwise the poison can enter the circulation and harm you. Now this process, incision and suction, removes 20% of the injected venom if it is done within the first 30 minutes. Then the third measure is giving the antivenom. Now it is of two types, specific or polyvalent. Specific is made by hyperimmunizing the horses against a single specific snake poison, and polyvalent, it is basically made by hyperimmunizing the horse with the against the poison of many different common snakes. Now how to give it? Basically we give 60 milliliter generally in an adult. We mostly give 60 milliliter of polyvalent antivenom. 1/3 of it is given subcutaneously or locally around the bite site. And then the next 1/3 is given intramuscularly, and the remaining 1/3 is given intravenously. But this antivenom that we gave will only neutralize the toxin in the general circulation. Now what about the toxin which has already bound, which has already been bound on the tissues? Now for that, for elapid bite, to neutralize the toxin action at the tissue level, we give neostigmine atropine therapy, and for viper bite we give heparin and supportive fibrinogen transfusion. Now what are the general measures? The fourth line. Basically, in case of paralytic cases that are caused by elapids because they produce neurotoxins, we give stimulants. We give stimulants and artificial respiration. In hemorrhagic cases which are mainly caused by the vipers, we can transfuse whole blood. For allergic manifestations of antivenom therapy, serum sickness can also occur. Make sure that you do a test dose before the therapy. So for allergic manifestation, we give steroids, and for secondary infections, we give aspirin or short-acting barbiturates, and we can also do the antibiotic prophylaxis.